This is the Pennsylvania Report with State Senator Sean Wiley. The Pennsylvania Report, a look at your state government working for the future of Erie County. Hi, thanks for watching. We are talking with Senator Wiley about a problem that is becoming statewide and one that maybe would take you by surprise, and that is heroin addiction, opium addiction. It's something that's popping up all across the state, in all corners of the state, rural and urban, and it's something that we have to do something about.
Addiction doesn't have a zip code, and it's really been a very difficult challenge that we've been facing specifically in Northwest Pennsylvania. Northwest Pennsylvania is very convenient for our drug dealers because it's very close to Detroit and Michigan, and also into Ohio and in New York. So it's kind of a hub, unfortunately. And we've been attempting to address this need with members throughout the community. The need of awareness and the need of how we can assist and also where people can go to learn more about this addiction if they have a family member that does have an addiction, and also treatment. And I think that those are all key elements. One thing that we've been doing is hosting naloxone events, and basically with the kits, the naloxone kits, which naloxone gives people a second chance. If there's someone that overdoses, it's a very simple procedure, simple application that gives someone a second chance at life, a second chance of getting clean. And we've been speaking to a lot of family members that have those that are addicted, and really attempting to train them on how to use the equipment, but also when they leave these sessions, they walk away with a kit. And that's incredibly important for family members to be able to have this. When we passed this legislation last year, I thought it was monumental. I think with the standing prescription that the script that the the physician general has written for the state makes it easier for us to be able to make sure it gets in the hands of public safety and those that need it the most. So our sessions are training sessions, and our first session was in East County in Erie, and we had over 100 people there. We had 100 kits that we gave out. And this next one is coming up, and we're going to be able to have even more kits because we partnered with UPMC Hammett, which is one of our hospitals up there, that are really helping us and assisting us in funding for the kits.
Let's talk about the importance of Sue Johnson to all this.
Sue Johnson's an angel. Sue is the mother of, unfortunately, a young man that passed from an overdose, and she's directed her grief in such a way that is really helping others that are facing the same challenges. Sue is working hand in hand with us to really raise that level of awareness and really helping us organize with other families that she's aware of and getting them the services that they need. Sue came to our office a couple of years ago and told us of her story, and that's when we jumped on board and we really started to move forward in how we can address this issue. What's the most responsible way or the most effective way that our office, my office, can work with them to address this issue? And we found that a lot of it is through awareness, and a lot of it is through the training of some of the equipment and the tools that we have to fight this disease.
Now, you mentioned naloxone, which is something that all public safety and law enforcement people have. You can also give that to the families of an addict. That is a stopgap for right now to get an addict who is overdosed back into health. What do we do in the long term?
Well, that's a concern because when someone is into treatment, right now I think the funding stream lasts for a very short period of time to keep them in a specific amount of treatment. Well, to overcome this addiction, it takes a longer time than that, much longer time in treatment. Heroin has amazingly negative effects on the body, and it takes about 6 months for someone to really start to begin to recover. But I have to say, we don't fund that appropriately. So we're giving people an opportunity to address their immediate concerns, but in the long term, they have such a battle to face to overcome this addiction that we have to do a better job of that as well.
What part does insurance play in this? I'm sure when somebody goes into a care treatment facility, insurance is a big part of paying for that. Where do we stand on that?
Well, the insurance component of that, a lot of our insurance companies do address it, and they're very responsible in how they address some of the emergency situations that come into play. And if you talk to our coroner, I mean, it's had a significant impact on how many people have been affected by this. So the insurance companies are addressing that need. I think that we have to continue that conversation to make sure that long-term care in insurance will address some of those needs. I think that there's an opportunity to get better at that as well. And I think that's just a matter of a conversation to really see how we can work in partnership to make sure that our people are getting the care that they need.
Community would play an awful lot of role in this, an awful important role in this, they say. When somebody actually goes through treatment, gets out of treatment, they're still really at risk, and the community has to get behind them to make sure they don't fall back.
Right. And we have amazing services available to us up in the Northwest. We have a number of providers that really do a tremendous job. But it's a matter of the families understanding what to look for. It's a matter of the families know where to go if they suspect that their child or a loved one is finding themselves with this concern. It all starts with prescription drugs most of the time, and we have to really make sure how we manage that at home makes a significant difference on the outcome of how we prevent this.
Let's talk a little bit about that, because what we've seen is somebody has some sort of a pain problem. They are prescribed OxyContin or some other very highly addictive drug, very legally by a doctor, and then it generally goes down into morphine or heroin. How do we take care of this prescription problem? How do we ride herd on that to make sure it doesn't get out of hand?
Well, it's difficult to get our arms around this because it's an educational process, not only for families and children and adults, but it's also an educational opportunity for physicians and how we prescribe. And I know that the Physician General has been working very diligently on how do we get that word out to physicians on how to address these issues in a different way. Truth is these medications that people are prescribed are designed to address their immediate concerns, and unfortunately, with some, they fall into a tougher situation. And so I think that educating the physicians more about what alternatives we can take to prescription, but also more importantly, how do we educate our families on how to ask the questions that they need to ask. And so it's a partnership with the physician and the family and the individual that's facing the challenges. And I think that we're going to be able to really make an impact with some of the events that we're having.
And let's talk very briefly about that. We don't have a lot of time left, but you are having these events all across the county.
Correct. And we're partnered with UPMC, like I said, and we are having these events across different parts of the 49th District. And I think that that's important too, because as I said in the first thing, is that this addiction does not have a zip code. It doesn't matter if it's a more rural or urban setting. There are people that face these challenges everywhere. So we decided to move this in different parts of the 49th District to give people more access to the information and also make sure that they're aware that this is available to them.
All right, so if you have any questions, if you'd like to get in touch with the Senator about this program or talk to him about anything, all of his social media information is at the bottom of the screen. In a couple of seconds, we'll tell you how to get a hold of him at his district office. Thanks for watching.
People with disabilities may request a transcript of this program by calling area code 717-787-5166. The TTY number is 1-800-364-1581.